Um, there you have it. So you can rewatch it on the NEDA Know How webpage, which you will find on that big website out there. So let me stop nattering and welcome Dr. Devon Hodge of Miller & Associates Equine Veterinarians. She's going to discuss metabolic disease. Dr. Hodge earned her BS in biology from Monmouth University and her DVM from the University of Missouri. Following an internship at Carolina Equine Hospital in Brown Summit, North Carolina, Dr. Hodge then moved to Florida, where she worked as an associate veterinarian for the next 6 years. During that time, she continued her education with advanced courses in equine podiatry, reproduction, and emergency medicine. In her free time, Dr. Hodge enjoys riding and showing her 2 off-the-track thoroughbreds and spending time with her children, Reagan, who's 5, and Baron, who's 3. So Dr. Hodge, I will pass it over to you. Thank you for being here.
Thank you for inviting me. Thank you, Dawn, for reaching out, Iris, and everyone for having me tonight. I'm happy to be here. I always enjoy doing client education, and we're certainly going to leave time for all of your questions at the end. If you have specific questions about your own horses or anything of that nature, we will definitely allow time for that. So as Iris mentioned, I am a veterinarian at Miller & Associates. This is kind of a picture of most of our crew up together. In our main office, which is in Brewster, New York, we also have locations on Long Island, in Wellington, and in Ocala. I'm one of the 2 full-time Ocala veterinarians. So I think my weather was probably a little bit better than yours today, but that's where I'm located year-round most of the time, although I do make trips to the other offices periodically. So I think you already heard all of this about me, but I'm a University of Missouri grad, and I've spent most of my time practicing down here in Florida. I don't really like the cold weather, even though I'm from New Jersey originally. So that was enough of that for me. But I have done continuing education in podiatry, which is where I got interested in laminitis, which is kind of my connection to the equine metabolic disease topic. And you'll see how that all ties together later. But I also love neonatology, emergency medicine, reproduction, lots of fun stuff. So I have dabbled in dressage, but I'm more of a hunter jumper myself. And there's an update. I now have 3 horses. I got a warm blood recently, so she's 3, and she just had her first ride by my trainer yesterday. So we're going to start off. Does anyone recognize either of these 2 horses or both? I'm sure you're more likely to recognize the top one. In my world in Ocala, when I presented this earlier, everyone knew the bottom picture, but not the top one. So on the top, that's Rumnor. He qualified for the Tokyo Olympics this past year. And on the bottom, that's Barbaro, who was the 2006 Kentucky Derby winner. So the question is, what do these 2 horses have in common? And in case you didn't follow their stories, both unfortunately needed to be euthanized due to laminitis at the peak of their careers. So, you know, these are 2 horses that had everything going for them, were obviously extremely fit, in excellent condition. There were no expenses spared in their treatment when they, you know, began to show signs of this condition. But despite all the money and, you know, the best medicine in the world, they still succumbed to laminitis, unfortunately. So no horse is immune. Every horse has the potential to be at risk. So that's kind of why equine metabolic disease is important to know about and be on the lookout for, and is of concern. So we're going to focus on 2 primary metabolic diseases. The first is Cushing's disease. That's the common name that you may have heard. The official term is pituitary pars intermedia dysfunction. That's where you get the PPID. You don't really need to know that, but that's a description of what the disease actually is, which is a brain tumor on the pituitary gland. They have repeatedly shown that it is always a brain tumor. It is always the same type of brain tumor. It's an adenoma, which we'll get into a little bit more later, but it's very common in older horses. So pretty much every year they are over 10 years of age, it becomes more likely that they're going to develop this brain tumor. But we do have, luckily, a pre-mortem test, a easy blood test that we can do that's very reliable on diagnosing this. So we don't need MRIs or anything like that to see the actual tumor. We have very reliable, easy testing that can diagnose the condition. So the second disease we're going to talk about tonight is insulin resistance. And I like to describe this as pre-diabetes. Like if you go to the doctor and your doctor says you're pre-diabetic, that's very similar to the condition that occurs in horses. It very rarely in horses progresses into full-blown diabetes. That's almost unreported in horses. And I just put a note at the bottom, some other equine metabolic diseases, but these are exceedingly rare. Diabetes and hypothyroidism are extremely rare in horses. We almost never see those. I personally have not ever seen a case. They're almost unrecognized in horses, but they do get this pre-diabetes. So just like with people, it's often characterized by being overweight, having fat deposits, kind of having a pro-inflammatory condition that affects the entire body. So, and as in humans, it's diet related as well. So you may have heard the term equine metabolic syndrome. When you have insulin resistance and Cushing's disease together, that's called equine metabolic syndrome. I just wanted to start with the terminology because they're frequently interchanged and misused, but that kind of explains what we're talking about. So people might say my horse is metabolic, and usually in my experience, they're talking about insulin resistance only, but true equine metabolic syndrome is when they have both conditions together, which occurs about 30% of the time. So if you have a horse that's been diagnosed with Cushing's disease, it's a good idea to also test their insulin levels and vice versa, because they are closely interrelated disorders. They're both related to the hormone systems in the body, which are all interconnected. So it's very common to have both conditions simultaneously. So again, what's the concern? Bringing it back to Barbaro and Ramanor. So all of these conditions, individually or together, eventually can progress to laminitis, increase the horse's risk for developing laminitis. So insulin resistance alone can lead to laminitis. Cushing's disease alone has a sequela of laminitis. The risk of laminitis is increased if you have both, if you have equine metabolic syndrome with those two conditions combined. Now, there are other non-metabolic causes of laminitis, such as supporting limb laminitis. So if you have a horse with a fractured leg, and this actually was the underlying cause of laminitis in Barbaro's case, the racehorse. So he had a limb fracture and he developed laminitis on the opposite leg because he was constantly bearing weight on that limb, which horses are not meant to do. They can also develop laminitis secondary to severe illness, such as colitis, like diarrhea, or retained placenta in mares, any type of endotoxemia. Basically, any very severe illness in horses can lead to laminitis. But again, today we're going to focus in on Cushing's disease and insulin resistance as causes of laminitis. So why does this occur? So as horses evolved over hundreds of millions of years, they had to forage for their food, and they, were in these big open grassy plains eating these kind of low nutrient grasses. They definitely weren't high sugar, they weren't high calorie, pretty poor quality, and the horses had to survive on this. They also had to walk long distances. They had to walk around all day searching for their food sources. Nobody brought them grain in their bucket. So they're burning calories that entire time as they search for their food. So as a result, horses got very efficient at utilizing energy, at utilizing any food that they took in. So they didn't really need to manage their blood sugar very closely. They used everything that they ate. And that's how their metabolic system evolved. I'll also mention that, horses had a shorter lifespan. They weren't living as long. They had natural predators. They weren't protected in a stall. They had kind of a harder life than most of our domesticated horses do now. So from there, in a very roundabout way, we got to this, where we have very spoiled animals in their stall, nice, comfy bedding, warm, blanketed. Someone brings them all their meals. They're usually high carb, high calorie, high fat, high protein grains. And, it's delivered right to them. They don't have to walk anywhere to get it. They, even if they're ridden once a day, that's still pretty limited exercise compared to the 24/7 wandering around that they used to have to do to find food. And as a result of lack of natural predation and kind of having a cush lifestyle, horses are living longer now. So their metabolic systems were not evolved to handle this lifestyle that most of our pet horses currently have. So focusing in on insulin resistance specifically, there are certain breed predispositions, but I'll say any breed can develop laminitis. I've seen it in just about every breed. And I would also add warm bloods to this list, but you do, off the top of your head, think of ponies, of those fat little ponies. They're very prone to foundering. Also donkeys, if any of you have donkeys, they commonly get laminitis. But yeah, the little guys are pretty prone to insulin resistance. Morgans, you think of that thick, crusty neck, and that in itself can be a sign of insulin resistance. But kind of, you think of your heavier breeds, quarter horses, Pasafinos, and like I said, warm bloods for sure. Less common in thoroughbreds and your lighter breeds, but it is possible. Again, I've seen it in all of these breeds. But the common underlying factors are always diet related. So often high starch or carbohydrate feeds, as well as fresh grass, which is going to be your number one source of sugars in a horse's diet. Grass can also be in the form of hay, but that your fresh grass is going to be your number one highest sugar source, followed by those sugary types of grains, like any type of sweet feed, any oats or barley, which, used to be the mainstay of feeding horses, but they are very high carbohydrate diets. And then lack of exercise. So it doesn't take much exercise to keep a horse's metabolism in check, but they do need some, and some horses need more than others. Just like in people, there's a difference in genetic susceptibility between individuals, between breeds. So some horses are going to need more exercise than others to maintain a healthy weight. So what are the signs that we're looking for in terms of insulin resistance? So in the bottom picture here, I think that's what everybody thinks of, a very obese horse. He's quite a chunk. He's kind of fat all over. He's got a fat barrel, a fat neck, fat on his shoulders, fat on his hindquarters, his tail head, pretty much all over. But kind of the less commonly recognized presentation is the top picture. But this horse, I'd say I would be even more concerned with the top horse's risk for laminitis. So overall, that horse is not overweight. If anything, it's probably underweight as far as a body condition scoring system. But he has this regional adiposity, we call it, these regional fat deposits. So you can see kind of the crease in his neck where he has a cresty neck. You can see at his tail head, he has a big fat deposit up there. And the fat cells inside those fat deposits are actually metabolically active and make the horse more prone to insulin resistance in themselves. So I'd be almost more concerned with the horse in the top picture than the bottom one, but they're just two different presentations of insulin resistance that we see. So if we suspect insulin resistance in our horse, what can we do? There are two different commonly performed tests for insulin resistance. One is just a baseline insulin where you come in, it doesn't matter what time of day, when the horse has last eaten, you just pull blood. It's the most convenient because, usually you're just there for something else, for a physical exam or annual vaccines or something, you just pull blood. If that's high, great, that's a diagnosis of insulin resistance. But if it's low or equivocal, you really have to come back and do an oral sugar test. So I put the gold star next to the oral sugar test. I really recommend this test. It's more accurate and you can do it regardless of when the horse's last meal was, and it will still be accurate. So we actually give the horse a set dose of Caro syrup, and then 60 minutes later, we take a blood sample. So we are measuring the horse's response to a known dose of sugar, essentially, and we see how their body responds. And you get a very cut and dry positive or negative, as you can see at the bottom. So that's kind of the recommended test for insulin resistance, an oral sugar test. There are other tests that we can run and that are often included on your panels, that your kind of groups of tests that you'll send out. So if you ever see a copy of your horse's results, you might see glucose on there. To me, glucose is mostly an indication of what they last ate. So, if they just, or when they last ate as well. So if they just ate their grain for breakfast, it'll be high. If it's almost dinner time and, it's been 10 hours since they last ate, it will be low. That's about all that tells you. Leptin to me just says your horse is fat, which to me, I already knew by looking at them. So it's not a very important test to me. And ACTH is the test that we run for Cushing's disease. That I would recommend because, as we mentioned, about 30% of the time, these horses will have both conditions. So if you have a suspect or positive insulin resistance, horse with insulin resistance, then I would recommend testing their ACTH to see if they also have Cushing's disease. ACTH stands for adrenocorticotropic hormone, but again, you guys don't need to know that. That's why you have your. So if your horse has been diagnosed with insulin resistance, what can we do for that? Again, similar to people who are pre-diabetic, a lot of it comes back to dietary management and exercise. So as far as the diet, my favorite go-to is a ration balancer. So a ration balancer pretty much has all of the vitamins and minerals, nutrients that a horse requires in a day, but it's a very, very low calorie feed. It's also very low volume. I have one of those little McDonald's plastic cups that you get at the drive-through that I give my pony one of those morning and night. And she's happy. So it's a low volume, it's a concentrated feed. It's very low calorie and extremely low starch. So you're making sure that they get all of their vital nutrient requirements while not increasing their risk of insulin resistance. So, and then the other thing I do is try to limit their hay. They should be fed at about 2% of body weight. So we want to make sure we're not feeding over that by weight in hay. So, and also in these guys, I'd recommend a grass hay. So there's a misconception about alfalfa. Alfalfa is not actually any higher in starches or sugars. It just is higher calories. So if you're trying to pull weight off a horse, your grass hay calories would be a better choice.
And Dr. Hodge, there's a question in the chat. When it comes to grass hay, does first or second cut matter, or is that it's all relative?
There is an answer to that, but I don't remember what it is as far as which one is higher sugar. I always have to look it up. I think there is a very minor difference between first cut and second cut. I think your first cut hay is always better, including it's a lower sugar concentration. I think as you get
there's just a little bit, there's a bit of audio interference. I don't know if something's rustling across the keyboard near where the microphone is.
Okay. Can you hear me now? Okay.
Yes, definitely. Can you say that again?
Okay, so there is a difference. I just don't remember which way it goes. I think your first cut is preferable, as in lower sugar, lower starch, better for an insulin resistant horse. They just replied, I believe the second cut hay has a higher sugar count. I agree. I think that's correct. Yeah, but I would have to look it up. I always have to check on that.
Okay, thank you.
You're welcome. So, and then restricting grazing. So I have a picture of a grazing muzzle here. This is my favorite kind of grazing muzzle. If you do have one of these horses that we're trying to get to lose weight, it's called a Harmony muzzle, spelled Harmany. And I love it because they have a harder time slipping it off. You can attach it to a regular halter. So unless they're savvy enough to get their whole halter off, they can't get the grazing muzzle off. Or at least, they have to work a little harder at it.
There's another question.
Oh, sorry, I'm not going to check in the chat.
Oh, no, that's okay. That's my job. If is the steamed hay, you see a lot more about that lately. Is that making a big difference in this particular context?
So steamed hay, there's more research on soaked hay. So when it's like soaked in water and then strained out. And there are advantages and disadvantages to that. So, I'll sometimes recommend it in an acute laminitis case where we're trying to leach out as many of the sugars as possible. And I'll do like a laundry basket style. So you put the hay in a laundry basket, soak it in water for at least, I think it's like 2 hours. And then you lift it out like a colander and strain the water off of it. So it leaches out the sugars, but it also leaches out most of the nutrients. So you're kind of defeating the purpose of even feeding that hay other than keeping them busy. So, if that's our goal, if I have a stall rested horse that has an acute laminitis episode and I just don't want them eating anything, but they're bored out of their minds, I just want to give them something to chew on, sometimes I'll use that, but it's not really a good long-term option because it is kind of leaching out all of the nutrients.
And then there's another question about a product called Safe Starch.
Yeah, Safe Starch is great because safe starch and carbohydrates are kind of, those terms are used interchangeably in terms of horse feed. But yeah, Safe Starch, as it implies, is a limited carbohydrate type of forage. Usually it's that little chopped forage and comes in a bag, looks like a shavings bag. But again, you have to watch how much you're feeding of all of these. So, read your feeding directions, weigh your hay, read the back of your bags and follow those recommendations and your veterinarian's recommendations. But yeah, there are, a ton of forage options out there. Just in general, for these horses, you want a grass hay instead of a legume such as alfalfa because it will be lower calorie.
Thank you.
Mm-hmm. So in addition to diet, we want to encourage exercise. And like I said, it doesn't take much. So there are actually studies that show that just 20 minutes a day, 4 days a week is enough exercise for a horse to induce weight loss. So it doesn't have to be every day and it doesn't have to be a long time. You want to get them, at least trotting around. You want to get their heart rate up and get them working, but it doesn't take that much effort to actually get their weight going in the right direction. So then, what can veterinarians do on top of that? There are certain medications we can use. And I mentioned in the beginning that horses do not tend to have hypothyroidism. That condition is not really recognized in horses. It can happen in people and dogs. However, we will still treat them with levothyroxine because it kind of acts as a metabolic booster, speeds up their metabolism to encourage weight loss. So we're not treating hypothyroidism in these horses. We're just trying to speed up their metabolism so they lose weight. Another medication that we might use, often in more severe cases where the thyroel isn't enough, is metformin. And again, this is just to lower blood sugar levels. So these horses that are in kind of this pro-inflammatory state because their insulin is increased in their entire body, we're lowering their blood sugar, which will in turn lower insulin and ultimately decrease the risk of developing laminitis. And then, I do recommend retesting insulin levels after about 3 months of dietary management, and it's pretty reliable. You can actually see it go down with management of this condition. So, there are certain other diseases like EPM off the top of my head that the blood tests aren't very reliable as far as improvement in the condition, but insulin resistance is one where you can definitely see it come back into a normal range, and that's your goal.
There's a couple of questions in the chat. So as far as the metformin goes, humans often stay on metformin. Is that something horses would stay on as well?
My understanding is that, yes, they can be on it long-term, but I try to pull them off of it when it's no longer necessary. And I believe it's also more effective in pulse dosing. So every 3 months or so, give them a period of weaning them off of it and then restarting, just so it kind of maintains its efficacy. I believe if you give it 24/7 year round, it just kind of doesn't work as well.
And then there was another question about, mentioned the 20 minutes a day, 4 days a week. What about, horses that have had to be retired? Is there like a turnout recommendation? Is it just as much as possible, or what kind of is realistic for those guys that can't really work?
Yeah, I don't think, the study that I'm referencing, I think only looked at horses that were able to exercise. I don't think there's a recommendation on how much turnout, but I would say turnout is better than no turnout. The more they'll move around, the better. But, walking can go a long way as well. If it's 20 minutes of trot work, it probably would equate to, maybe 45 minutes walking around. So maybe a trail ride or whatever the horse is able to do.
Thank you. Doing a lot of questions in the chat here. There's a product, 2 products, Chromium and Hero, for lowering sugar levels. Are you familiar with those?
Have not heard of either of them. Send me the label.
Karen, if you want to send that to me, we will forward it on.
Yeah.
And then, they're coming in faster than I can ask. I knew this.
We will have time for questions at the end. But
yeah, go ahead, and I'll organize these going forward. How's that?
No problem. I love questions, but they might be answered as I go through this. So.
Okay.
Okay. So kind of focusing in on Cushing's disease now. As I mentioned, it is always a brain tumor. It's a tumor on the pituitary gland. It's a pituitary adenoma. That's the type of tumor. Adenomas usually are a benign type of tumor. However, since it's located on the brain, the size of the tumor directly presses on the pituitary gland and causes overproduction of cortisol. And that's why we measure ACTH, adrenocorticotropic hormone. So if this tumor were located anywhere else on the body, it would not be as problematic. But the fact that it's in the brain, pressing on a gland that releases a hormone, causes all the clinical signs that we see. As I mentioned, it's most common in older horses. They continue to update the recommendations, but pretty much any horse over 10 years old at this point, I try to test annually for ACTH, to test for Cushing's disease. So, for the most part, people think about the signs, the late signs of Cushing's disease. So like the picture of the pony I showed at the beginning with that long hair coat, kind of a pot-bellied appearance, not necessarily generally overweight, but just a pot belly. Other common signs, late signs of Cushing's disease are recurrent infections. So recurrent hoof abscesses, recurrent eye infections, non-healing wounds. I've seen all these in horses with advanced Cushing's disease. And again, these are all often the horses that are not overall overweight, but will have those regional fat deposits. A lot of overlapping clinical signs, as you can see with insulin resistance. And, you know, sometimes laminitis is our first clue that the horse has Cushing's disease. In cases of acute laminitis, I don't tend to test their ACTH right at that time when they're having an acute episode, because the stress of having a laminitic episode will cause their ACTH to rise. However, once they've gotten over that acute episode, I will test them for Cushing's disease, so we can find out if that's a condition we need to manage to prevent future episodes. So, you know, that's what people think of, but what we really want to get better at is recognizing the early signs of Cushing's disease, because if we can diagnose and begin treatment sooner, we can prevent hopefully some of these later signs, including, you know, worst case scenario laminitis. So early signs, you might just notice delayed shedding. You know, your horse is keeping his winter coat a little longer into the season. Or I'll also add in there partial shedding, where they'll mostly shed out, but then they'll have just kind of tufts of long hair in various spots on their body. That can be one of the earlier signs. Loss of top line. So, you know, nothing has changed in their feed program or their exercise program, but they're just kind of lacking that muscle along their top line. And there's no explanation as to why. Abnormal sweating. So it can be increased, decreased, or patchy. Those can all be signs of Cushing's disease. And tendon or ligament injury. So this is one that we think of relatively commonly, you know, being a sports medicine focused practice. And I'm glad that I know this tidbit of information, because it can help me manage these injuries. So if I have a horse over 10 years old with a tendon or ligament injury, I'll often test them for Cushing's disease, because if that's an underlying cause of why they sustain this injury, we can treat and manage that and hopefully prevent re-injury and speed up healing. And just generally decrease performance. So again, your horse is in the same work program, exercise program as before, and just isn't performing up to par or as well as they used to. So this is kind of a scary chart, but it, you know, don't be overwhelmed. I'll give you kind of a minute to take it in, but essentially, so these are the months. It's January, February, down to December. And all it's saying is there's a normal seasonal rise in this hormone that we test, the adrenocorticotropic hormone. So it doesn't mean that we can't test at different times of year. It used to be that they didn't have established reference ranges in the fall, but as you can see, we just adjust the reference range based on the time of year.
Would you adjust your testing because of the time of year to go with that, or just the results you'd expect back?
Sorry, it's the same test, same blood test. We just interpret it differently based on the seasonal rise. Do we have more questions?
We do, actually. So there, I've got a number of questions about specific products that I'm hanging on to. There's a question, you know, you hear a lot about the winter laminitis, and it seems like this is what people are talking about, or is there a different actual diagnosed winter laminitis that they're talking about as opposed to the rise in the levels here?
I'm trying to find the actual question, because
some of them come to me directly without being public. So the question verbatim was hearing winter laminitis being discussed a lot in forums and wondering if it's a real disease or if it refers to this.
I think laminitis is laminitis. It can happen any time of year. I haven't heard specifically about a condition called winter laminitis, but I certainly have seen laminitis any time of year. You think of it most commonly in the spring because that's when the fresh grass comes in, which, as I mentioned, is going to be your highest sugar content out of all the things your horse eats. But that's not the only thing that can induce a laminitic episode. So yeah, laminitis can happen any time of year. And, as we talked about briefly at the beginning, there are non-metabolic causes of laminitis as well. So that might be more what you're dealing with if you're seeing it in the winter. It's not always diet related. But yeah, and I mean, I just went to the FAEP conference and went to multiple laminitis talks just a few months ago. I think it was in January, and I did not hear winter laminitis mentioned. So I would think if that were a new thing, they would have brought it up at that conference. So I think, we're probably all talking about the same thing, laminitis.
And then I don't know if you have coming up in your slides any kind of reproductive implications. There's a couple of interesting questions around, does this impact fertility and is it hereditary? Were these animals that you would recommend breeding, or is it more of an environmental issue?
There are reproductive implications, and I love repro, so it's definitely something I consider when I'm breeding a horse, but I didn't include it because I kind of thought it was outside the scope of this talk. This kind of a very general overview. But yep, having Cushing's disease does, or insulin resistance, and especially both, negatively affects the mare's ability to get pregnant. And both of these conditions need to be under control before the horse is going to conceive. And as far as the genetic predisposition, just in that certain breeds are predisposed. And just like in people, if your parents were overweight, you're more likely to be overweight and thus more prone to this condition. I'm not aware that they have established a genetic connection with Cushing's disease, but definitely with insulin resistance just based on being overweight or, being a pony or a mini or a quarter horse.
Thank you. I think the other questions I've collected are related to specific products.
Okay, yeah, we can definitely discuss all that at the end, but I'll leave it till then in case, other people want to jump off here. So just kind of going back to this slide. So we run the baseline ACTH test. No preparation is required for this one. However, if we land in that equivocal range, what do we do? Well, in that case, we can do a TRH stimulation test, which is a bit of a more sensitive test. So if we're in that equivocal range, we still can get our answer. The TRH stimulation test can only be performed between mid-November and mid-July. So we don't want to do this test in the fall. So then management. I'm not sponsored by Boehringer Ingelheim or anything, but they make the only well-researched and effective treatment for Cushing's disease, which is Presend. The drug name is Pergolide. On average, most horses start on 1 tablet a day, a single 1 milligram tablet. However, I've had horses need to go up to 5 a day in more severe cases that don't come under control. But it's very effective. I definitely have seen improvement in clinical signs with this treatment. I always get the question, does it actually shrink the brain tumor? We don't know because we don't really have the ability to image the brain of horses very well yet. And most of the horses don't go through that procedure. So we don't know, but I have seen it mitigate clinical signs enough that I would certainly recommend treating if your horse is diagnosed with Cushing's disease. So since different horses do require different dosages to get the disease under control, I always recommend retesting once they've been on it for a couple of months. Usually about 1 to 3 months is when I'll retest, and then kind of continue that throughout their lifetime, just to make sure that we're still keeping the condition under control. So another, a small plug for BI, they're great with this medication, and they do offer complimentary testing in the fall. That says 2021, but they do it every year. So, if you're suspecting this condition in your horse, or you're curious, ask them if they have any free tests available. I believe each veterinarian gets 3 tests each year for free. So, they want these horses to be diagnosed, and as I mentioned before, diagnosed earlier when they're showing those early signs, and before it progresses to the more severe and more obvious signs, and ultimately laminitis.
And as far as Presend itself, are you aware of any particular side effects?
Yes, so the most common side effect of Presend is horses going off feed, and they don't think it's directly related to the taste of the pill, because you can take the pill out of their feed and they'll still not want to eat, but it does suppress their appetite. It's usually when the medication is first started. And if that happens with 1 tablet, we kind of have some ways around it. So we can try breaking it up into a half tablet in the morning, half at night. We're doing every other day. And usually when you back it up and reintroduce it more gradually, you can get around that clinical sign and they'll start eating again. There are no other recognized negative side effects of this medication. It's extremely safe. It's just that sometimes they'll go off feed at the beginning.
I would ask if you're able to see in the chat, Linda's asked, I think she's familiar with lab results. I don't want to say incorrectly, do you treat the equivocal horses based on the TRH response, the 100 to the 200 range?
Yeah, me personally, I do, because it's such a safe medication and there's really no negative. And then I would just wait and retest in a couple of months. I would treat them in the meantime. So if they fell in that equivocal range, I personally would probably still treat the horse. And then, you also have to consider clinical signs. So if you were testing the horse because you suspected Cushing's disease and they came back in the equivocal range, I would probably treat. However, if that positive came up on a pre-purchase exam, say, and it was just an FYI test, I would not necessarily treat in that case if the horse didn't also have clinical signs. Oh, it's a long question.
Yeah. Well, there's another I got privately prior to that, just about the Presend. You recommend using, is it chasteberry to support the Presend? Is that? Yeah.
So I'm all for herbal supplements, and I think it can't hurt, but it certainly is not going to replace Presend. So it could be, a good additive, but I wouldn't use it as a medical treatment, just as an adjunctive treatment.
And I can save the, I know there's a lot of questions in the chat, so I can save the specific ones I've copied and pasted into one area so we don't lose them for later.
That's okay. I'm glad you guys have so many questions.
They do. Keep me hopping. Yeah. If you're testing for a response, does the blood draw have to be at a certain time relative to when the pill is given? Does that interfere at all?
Nope, because it takes a while for that medication to reach steady state in the bloodstream. Like even when you first start giving it, it's going to take, if I remember correctly, a number of weeks. So there's not going to be a huge rise just from them eating the pill that morning, and how much it's going to go up by the end of the day. Probably wouldn't be significant. What you're trying to see is what their steady state is at that time on that dose. So, I would probably have them on the same dose of medication for about 2 weeks before you run that retest.
Thank you. Mm-hmm. We've just got another comment in the chat of someone who had 2 horses who did not respond to the pergolide happily. So
Oh, loose stools, yeah. I've heard the off feed. I haven't had any with loose stools, but you know, another thing that I'll say with that is these are often older horses that have other problems going on. And, you know, if signs like that pop up, it may seem to coincide with the medication, but sometimes it's just that the horse is old and has multiple medical conditions, and it was kind of more of a coincidence.
Thank you.
Mm-hmm.
Other than that, it's the specific case questions so far.
No worries. Okay. Last time I presented this, I had a BI rep there with me, so I just directed all the medication questions to her, especially the side effect ones. Like, here, you answer that. So moving on to laminitis, which, as we talked about, is the most concerning potential sequela of either of these conditions. So what is it? So in its acute and most severe form, it's rotation of the coffin bone within the hoof, or the pedal bone, P3, that last bone in the bottom of their toe. So if you compare the first picture to the second picture, you can see that that bone has rotated down away from the hoof wall. It's supposed to be really tightly connected there. The connection is almost like Velcro, actually, with the interdigitation of the lamina, the laminae, which is where the condition gets its name. And when that rotation happens, it pulls apart. And once that happens, it never goes back together. It cannot recover. So that's why, you know, often these horses, if their acute episode is not adequately treated or managed, they can develop chronic laminitis. And it's kind of a problem for the rest of their lives. So, you know, once it rotates, it will never bounce back up. Now, as the hoof grows down, you can have normal hoof growing down that will replace it if you can fix the mechanics of the foot. However, again, once it's rotated, it can't unrotate. Another kind of type of laminitis that you can get is sinking, where there's no rotation down from the hoof wall, but the bone within the hoof capsule just drops straight down. So that's a little bit harder to diagnose on x-rays, but often those are the more severe cases and the more difficult ones to turn around and manage. So our diagnosis of laminitis, of course, starts with an exam. These horses will often present as, let's see, I had one last week that didn't want to walk up from the pasture or didn't want to walk at all when you were leading them. You know, they'll be leaned back, trying to take the weight off of their front feet. They might have like a walking on eggshells appearance where they just look sensitive. Usually it's the front feet that are more severely affected, and usually it's both front feet. So if we suspect that, we'll take x-rays to not exactly confirm the diagnosis, but to see if there are any bone changes going on. So see if we have any of that rotation or sinking, which would make us more concerned. And this can happen pretty quickly. So, you know, it can happen within days to weeks of the condition. It certainly doesn't happen every time. There are a lot of mild laminitic episodes that, you know, resolve as quickly as they came up. They really were just kind of in the inflammatory stage. The bone didn't get displaced at all. And we were able to stop that inflammation before there was any permanent damage. So that's kind of our goal, is to catch these early and stop the progression. But once you do have that rotation, it's a little bit more of an uphill battle to get the horse back under control. So in addition to plain x-rays, the image on the far right is a venogram. That's another diagnostic we can do to help us assess the severity of the laminitis and damage to the blood supply. So what we do is we inject contrast into a vessel going to the foot, and then we take x-rays and we get that nice pretty image, as you can see there. And like I said, that gives us an idea of how good the perfusion is, how good the blood perfusion is to the tip of that bone. So as that rotation and sinking happens, that tip of P3, the tip of the bone puts pressure down through the sole, and that is extremely painful. That pressure also cuts off blood supply, and the bone, needs blood supply. The foot needs blood supply to survive, of course. So if we don't have good blood supply there, the horse kind of has a worse prognosis long-term for recovering, especially to an athletic career. I could talk about laminitis all day, but I want to leave time for questions at the end. This is kind of my primary area of interest. So if anyone wants to know about laminitis, happy to discuss. So if we have an acute laminitis episode, so this, just started, what do we want to do? Icing the feet is the #1 best thing you can do to halt the progression of laminitis. It is an inflammatory condition. I mean, you'll feel these feet are just on fire. You put your hand on the hoof and you can tell it's hot. So ice, just sticking them in a bag, in a boot of ice, is the #1 best thing you can do. You want them to be soaked in ice up to the level of the fetlock. So there are a ton of commercially available ice boots out there. Unfortunately, the research is that none of them work as well as submerging the horse's foot in an ice bucket or ice bag. You really need to have them soaked in an ice slurry of sorts up to their fetlock, and it needs to be 24/7 to be effective, which is very difficult to manage in the field, even difficult to manage in a hospital setting. I mean, here in Florida, that means you're changing ice out about hourly as it, just melts as soon as you're putting it in there. But you don't want it to end up being a hot bath. You have to keep it cold. But it is the best thing you can do to halt the progression of acute laminitis in its tracks. In addition, we want to give anti-inflammatories. So bute is usually the first go-to, but we have additional pain medications we can add in on top of that, additional anti-inflammatories. Tylenol is one of them that we can add in. That's kind of more recently been used in horses for the first time. If this is something long-term, chronic laminitis that we're managing, we'll often use Equiox because that has fewer GI side effects while still providing the anti-inflammatory and pain control. And yeah, there are more stronger pain medications we can go to because this is a very painful condition for sure. Soft padded boots of some type. Soft Ride is a popular brand of them, but there are others. There are cloud boots. They're all the same idea, but essentially you want thick cushioning under the foot because, as I mentioned, you have that rotating bone. It's putting pressure straight down through the sole, and that really is the primary source of the pain. So Soft Ride boots will really help their comfort level, especially initially. If you don't have Soft Ride boots, which most people don't on hand if this is their first rodeo through this, but deep bedding can work. The horse I saw earlier this week, they had a very muddy like barnyard area, and I told them to just turn the horse out there because that soft, cold, deep mud can actually be a really comfortable surface for their feet when they're having an acute episode. They can kind of find where they're comfortable by squishing around in the mud. That's what ponies in the wild will do.
There's a question: do they, if the horse has pads, would you recommend pulling the pads just so they can get does that insulate the temperature at all? And you want to pull those, or does that matter?
So I would base it on the severity of the laminitic episode. If it's really mild, you could consider keeping the shoes on, but if it's moderate to severe, I would pull the shoes and just put a straight cushion on the bottom. You can always put the shoes back on later.
We have a member sharing an Amazon link for ice boots. So.
Yeah, I wonder which ones, because soaking boots, yeah. My trick for soaking feet, if you ever have to do this, is these IV bags. Yeah, that I included a picture of. You cut the top off, put them on the foot first, scoop ice in, and then duct tape the top. And they're thick enough that it usually takes the horses a while to wear holes in them. Yeah, they're the most convenient option I've found, but still super inconvenient. So as you kind of go through managing the laminitis episode, you're going to want to manage the mechanics of the foot, which is what these x-rays at the bottom show, with the derotation trim. Sorry, it moved my after picture. But so this before and after was over a series of mini trims. You can't affect that large of a difference all at once, or they would be very sore. But that's kind of the idea of what we're going for with a derotating trim. So again, we're trying to eliminate that pull of the bone, P3, away from the hoof wall. So, because again, that's what's causing the pain in this condition. So if we can ultimately get the horse to a 0-degree palmar angle, parallel with the ground, bone is parallel with the ground, it takes that pull off of the lamina. There are multiple ways to accomplish this. A tenotomy is one of the things that we'll do in more severe cases. So can you guys see my arrow? Yeah, okay.
Yeah, if you move the pointer, it's a little small, but we can see it, yeah.
Okay, so the deep digital flexor tendon connects on the back, comes down here and connects on the back of P3 here, and it pulls it backwards. It pulls it that way. So like in this picture, you have the flexor tendon coming in and pulling it, and that is another force that causes that rotation. So in more severe cases, we'll snip that tendon to eliminate that pull. But again, I'm getting way too into my favorite topic. So this is very, very detailed. That would only be in a very severe case, and hopefully you never have to worry about that. But you know, I do some form of corrective shoeing pretty commonly in these cases. Even just a little bit of rounding of the front of the shoe can ease breakover and take a lot of the pressure off of that toe. So there are little changes you can do with corrective farriery that make a big difference in the mechanics of the foot. All right, so, you know, the one thing that we can do to prevent insulin resistance and subsequently the development of laminitis is weight management. So it's good to know what your horse weighs. This is just a generic weight tape that you can pick up at most feed stores or from your veterinarian. But it's good to keep an eye on that and just know what a baseline is, so you know if your horse is gaining or losing, and adjusting their feed accordingly. I don't really have any great tips on how to prevent Cushing's disease. You know, I'd probably be able to retire if I knew that answer, but you know, horses are going to get older, and the older they get, the more likely they are to develop the condition. But recognizing it early, testing early, and getting them started on medication definitely seems to decrease the clinical signs and let them lead a happier, more comfortable old horsey life. All right. So now I will take any of your questions.
Let me start with, we had a real detailed one a little bit ago. So there's the 14-year-old Lusitano FEI level diagnosed 3 years ago because of increased urination and an on and off foot soreness after shoeing. The ACTH is normal and the TRH is elevated, but could the soreness be early Cushing's? They're having trouble building the top line again after a tendon injury. They're on Presend and a low starch diet, high forage and some alfalfa. their exercise daily. Do you recommend any kind of supplements to try to help out, or adding oils? There's a lot of detail here.
Sure. Well, listening to the beginning of that history, it sounds like that's a case where I definitely would treat, even if they're negative on a baseline ACTH, because it sounds, Presend is such a safe medication, and it sounds like the horse could benefit from it. I have seen increased urination or increased drinking as clinical signs. The list of clinical signs is so long, I couldn't even have fitted on one slide. So I picked a couple of the most common, but based on those clinical signs, you check a couple boxes in combination with the increased response to TRH stim. I would definitely be treating that horse with Presend, which it sounds like you are. And then the dietary management, I would just based on their weight and their body condition score. If they are overweight or have those regional fat deposits, then I would be trying to manage their diet, which it also sounds like you are. So, it sounds like you're doing all the right things, and I agree with your veterinarian's decision to implement those. As far as supplements you can add in, my favorite is Insulin Wise, which is by Kentucky Performance Products. That's a well-researched product that has some good science behind it. And that's obviously for insulin resistance. For Cushing's disease, someone mentioned the chaseberry. There are some herbal supplements. I think SmartPak sells some that, like I said, I think are fine to use as adjunctive treatments. I just wouldn't expect them to treat the condition in and of themselves, because they're not really medications. They're supplements, herbal supplements.
And another semi-related question that came through, are Iberian breeds in your kind of danger breed list, or is that not?
I'm pretty sure they are. I don't specifically know a lot about them, so I'd have to look that up. But based on they're like one of those cold weather breeds, I think, right? So
the Spanish, that Iberian Peninsula, it's like the Lusitanos and the Andalusians.
Oh, yes, Lusitanos and Andalusians, all of them. For sure. They're high up on the list, unfortunately.
Fair enough.
Yeah.
Got some questions around the dosing of a number of the medications. So for example, I think this was regarding the Presend. If the dosage needs to be increased on a medication during the seasonal rise, can it be decreased again if the horse tests normal after the seasonal rise, or is it a constant dosage typically throughout the life of that animal?
You should not have to be going up and down. That's kind of atypical. Usually, if anything, you might need to very gradually increase the horse's dose over their lifespan, but in small increments and not very often. Again, I would just interpret the seasonal testing based on the seasonal reference ranges. So if it's high according to the reference range when you tested it, then I would say that's high. If it's in the normal range, then you're good. And actually this past year, the Tufts Equine Endocrinology Group, which gets together every year to update the recommendations on these conditions, came out with an extremely complicated series of reference ranges for us to use to interpret these tests. So it's not even as simple as spring and fall anymore, but your veterinarian has access to those reference ranges, and they're very specific and very seasonally dependent.
So anyway, Tufts University, right up here, Tufts
University. Yeah, okay. Well, it's the Tufts Equine Endocrinology Group. I think because they meet at Tufts, but it's veterinarians from all over the world. But internal medicine veterinarians. Yeah.
Okay. Thank you.
Yeah, no problem. So anyway, yeah, I would just, base the interpretation of those tests on the seasonal reference ranges and go from there.
Okay. And then there's a couple of questions around what you said about the metformin not being so great to just have on continually. Can you talk a little more about how that works, the coming off and coming back on again, and how that helps them? There's some.
Yeah, well, just most medications that we use long-term, the body kind of loses its responsiveness to that medication over time. So just stopping for a couple weeks to a month and then restarting, you'll get a better effect, better response when you restart, rather than just having them on it 24/7, 365 days a year. However, if the horse is critical and is really dependent on that medication, I wouldn't, risk their condition to take them off the medication for a couple months. And if I did do it, if I had one that tended to get laminitis episodes seasonally in the spring, then I would try maybe taking them off it for a month in the winter when they were at a lower risk.
Okay, thank you. That's good to know. And then I've got a question here. I've read that it is the excess of insulin that that causes laminitis, not necessarily sugar that causes the syndrome. Is there research being performed to control insulin production?
There is. So they've looked into some of the diabetic medications, these are always hard to pronounce. Valiflozin, something like that. Anyway, they all have these very complicated names, but yeah, essentially, just like people with diabetes would take. They're currently pretty cost prohibitive to use in horses because of their size, but they are researching that for sure. And yes, you're correct. It's the insulin in the bloodstream, not the sugar itself. And pretty much a general overview of how glucose and insulin work. Glucose goes up, insulin goes up in response. And unless you have a PhD in this topic, that's pretty much all anyone knows as far as how insulin works. It's so complicated, and really we don't understand it very well at all beyond that. So yeah, but it's the hyperinsulinemia, the increased insulin in the bloodstream, that causes this pro-inflammatory state. And so the reason that we see laminitis secondary to that, and laminitis secondary to other inflammatory conditions in the feet, is there are these tiny little capillary, tiny little blood vessels where they have to make these hairpin turns at the tip of the foot there, and then go back up to the rest of the body. So the blood comes down to the foot, has to get into these tiny little blood vessels and turn around and go back up to the rest of the body. So the most likely place where you're going to have a problem is in those tiny, tiny little capillaries. So that's our understanding of why the feet tend to be affected in these pro-inflammatory conditions, such as hyperinsulinemia.
Okay, let's see. I'm just trying to make sure I'm not missing anything here. I know we've kept you past, so I'm trying to.
I don't mind. I'm having
validate here. Let's see. How do you feel about the quiescence supplement, magnesium and chromium based, to help prevent these issues? Do you have any thoughts on those?
That one I have at least heard of. I'm kind of not big on supplements in general. I think a lot of horses are over supplemented, and I think most of the supplements that we give don't do much, but also most of them are extremely safe and can't hurt. So that kind of falls into the might help, won't hurt category for me. Okay.
And then have you any thoughts on a product called Insulin Wise? And that will close.
Yes. Yeah, that's the one that I mentioned as I do like Insulin Wise. I'd recommend adding that in for any insulin resistant horse, especially if they can't, if they're not well controlled with Thyro-L alone. Yeah, I think that's a good product. And that is one of those few supplements out there that has been very thoroughly researched and has some good evidence behind it.
Okay. And then I think we're up to just the most recent questions here. So spring grass, talking about the fluctuations in sugar content, and again, based in sugar, do you have any recommendations for safe things that can be added to horses like this feed who get the Thyro-L and the Metformin, all of these medications, and are not super pumped about eating all of them, but you can't put sugar in, right?
Okay, so what can you hide their medications in?
Or what's, is there a safe sweet additive that can kind of be used as treats for making feed more exciting?
Yeah. Pretty much if it's sweet for us, you want to avoid it for them. I mean, and I tell people I'm fine with fruits and vegetables. Like, they're healthy for people. They're pretty healthy for horses. If you want to do carrots, apples, if that works, that's okay. It's not too bad. I would definitely steer clear of molasses. Unsweetened applesauce would probably be okay. But, I think if you put enough of a ration balancer as your grain base and mixed it in there, if they like to eat, which if they're overweight, they probably do, I would think they would clean it up in their ration balancer.
Okay. Yeah. I'll just mention, I have one of these horses and he loves the peanuts and the peanut shell. The whole
That's
thing.
a great suggestion. I've never heard that. Yeah.
That's a hot
They learned
currency.
something new.
Let's see. Can insulin resistant horses safely use sugar substitutes? Those like sativa, stevia, or whatever the like we have for coffee packets.
I'm not aware that that's been studied in horses, but my guess would be no. And the problem with those in humans and animals is as soon as you ingest it, your body recognizes that as sugar and metabolizes it the same way. So I'm kind of into human nutrition as well, just like on a personal level, like being an athlete. So I personally don't like any of those sugar substitutes either, because like your body still knows that you're taking sugar in, it's just in an altered form, and ultimately it goes through the same metabolic process. So my recommendation would be to avoid those as well.
Okay. And then a quick question on the best times of the day for grass containing less sugar.
Yeah, so you can find recommendations online for whatever you want to believe in on that. Some people say, and kind of the one that I most commonly go by is don't turn them out at dawn or dusk, because in preparation for night and in preparation for day, the sugars are highest in the grasses. So you want to turn them out in the middle of the day or the middle of the night, or both. But that means you're turning horses in and out, 4 times a day. So it's not very feasible. And you can also find the opposite, research. So it depends who you ask. In general, in the spring, those new roots, those fresh new grasses coming up are the highest in sugar, those little baby stubs. I just had a discussion with somebody last week who wanted to turn her horse out in what looked like a dry lot. And I said, it's just about early spring here in Florida, and those little shoots are going to start coming up, and the horses will eat them down faster than you can see them. So, by the time you recognize the grass is coming in, your horse has already eaten all those little baby shoots, and those are the absolute highest in sugars. So new grass, super high. As far as timing, day or night, I wouldn't work too hard. I wouldn't worry too much about that, because it's going to be a lot of extra turning in and out for you and for not a lot of benefit. And there's mixed research results on that. Your more effective way to limit grass intake is with a grazing muzzle. And as far as that goes, I should have mentioned this before, but the grazing muzzle needs to be on 100% of the time that they're out on grass. If you take it off for an hour, the horse will consume in that 1 hour what they otherwise would have eaten in a 24-hour period. So it only works if they have the grazing muzzle on all the time when they're on the grass.
They are very convincing about how dreadful they are, though.
Yes. Oh, torture devices for sure.
We just have Beth mentioning also that most horses like celery. So we're all...
Another good tip. I'm loving this.
Yes.
Peanut shells and celery. I'll have to remember those.
He does. The peanut is in the shell also. We don't unshell the peanuts. He eats the whole thing.
Okay. There you go.
I think that rounds out our questions. I really want to thank you for your time, because I think you've you have hit our record for the timing award for this year's.
I hope I didn't go too long, but
no. And of course, everyone's sticking around. So, everyone's right here with you.
All right, good. You stuck it out.
Devon, I just want to add my thank you as well. Thanks so much for both the insights and the time you've given us. This has been fabulous.
Oh, you're welcome. You're very welcome. I enjoy this, and I like discussing this topic, and my pleasure.
Wonderful. Yeah. Just a reminder, Dawn's going to send all the participants a survey to get your feedback. Let us know what you think. And thank you for your enthusiastic response. Have a wonderful night, everybody.
Yeah.
Thank you.
Thank you, Dr. Hodge. Lots of thank yous in the chat also.
Yes.
Thank you, guys.
Everyone have a good week.
You as well, Dawn.
You as well, Iris.
Have a good night.
Night.